according to the Task Force on Mental Health of 2020, mental illnesses such as depression and suicide, substance use disorder, bipolar disorder, and schizophrenia, and other psychosis account for 13% of the entire disease burden in Kenya. Men don't have a lot of avenues to talk about the issues that they are going through, and that's why we end up with higher suicide rates among men than in women.
I think that also coupled with just the everyday stress of the relationships that we have, maybe the workplace relationships that we are creating, and then if you add that to the economic stress that we have, it kind of like,
if it's the government on this SHA nonsense, they need to ensure.
Now? Is that because you just saw your payslip?
Wait. Hi guys, welcome to the rundown.
My name is Mihala Barasa.
And I'm Danun Yuko.
And today we bring you mental health regulation in Kenya.
Yes. And before we delve into the topic for today, please remember to subscribe. Hit the notification bell once you've subscribed so that you can know when we drop a new episode. We'll be dropping new episodes on YouTube every Wednesday at 10 a.m. Please don't forget. And if you would like to listen to our beautiful voices, you can listen to us on Spotify or on Apple Podcasts.
Big shout out to Lenny, one of my co-workers, listens to us like we are the gospel.
Oh, thank you, Lenny.
Thank you so much for listening to us. Yes. But today we delve into the topic of mental health regulation.
Yes.
So just to start us off, I want you to maybe take us through why you thought this was a good topic for us to kind of discuss today on the podcast.
Okay, so I'll start with a scary story. Okay, it was scary for me. So one morning we were driving on Thika Road and we saw a guy hanging from, so we'll call it a bridge or an overpass.
An overpass, yeah.
Yes, an overpass, early in the morning on a Saturday morning. And it made me think about the rise in suicide rates, especially in men in Kenya. And it's something that we've even talked about a lot with my husband, where he keeps on telling me a lot that men don't have a lot of avenues to talk about the issues that they are going through. And that's why we end up with higher suicide rates among men than in women. We don't have a lot of avenues for men to talk about the issues that they are going through. You find that ladies have different groups. A lot of ladies participate in their, if they are Christians, in their church groups and all that. They have different friend groups, they have chamas, a lot of places where they go and talk and vent. But you find men don't have a lot of avenues to talk about. And then also another thing is, as I was doing some research on this topic, I also learned that mental health issues, especially between 15-year-olds to 29-year-olds, is on the rise. And these are, according to WHO, they estimate that 20% of the world's children and adolescents have a mental health condition, with suicide being the second leading cause of death among 15 to 29-year-olds. Now, that's a scary statistic.
That's scary.
Yeah.
That's a scary statistic. And I'm very sorry that you had to see that on Thika Road.
Yeah.
You never told me this before, so I'm
yeah.
I'm sorry you had
to I think it was one of, I was like, what, early in the morning. And you know, the worst thing about it is when you witness such a thing on the road, you know you can't move the body until the police come.
Exactly.
Yeah. So you can imagine, you don't know how long that body has been hanging on the road, and people have been just there calling the 999, saying, come, there is someone who is hanging here, because you can't do anything. I think so. And you will find that there are many other stories that we may not know about. People who probably are found dead at home in their rooms, and the circumstances around their deaths, we are not told. You're just told that they were found dead in their room, and that's it. Yeah. And do you remember even the other story about the medical interns?
Oh, yes.
Who have also, the suicide rate among them
Has
gone up because of the working conditions. They're stressed about the many hours that they are working. So I think that all these issues that have come, and even the mental stress in the country right now, I think one of the things as Kenyans we have learned is to make light of a lot of the situations. But the fact is, we are struggling financially. A lot of us are struggling financially, and which is having a very big impact on our mental health. Yeah.
I think that also coupled with just the everyday stress of the relationships that we have, maybe the workplace relationships that we are creating. And then if you add that to the economic stress that we have, it kind of like now just boils and bubbles over and probably like increases the rates of suicide in the country. And there is at least, again, a heightened awareness that this is something that is happening. And there are a few or some measures that organizations and companies and the government is taking to help out. But then the question that we're asking ourselves today is it really enough?
There's also the need for awareness on what do you do when you have a mental health issue? How do you prevent mental health conditions? How do you ensure that if you're going through something, that you deal with it in the right way so that it doesn't have an impact on your mental health? Before we delve into the regulations that promote mental health awareness in Kenya, maybe we can look at some statistics around mental health in Kenya. So according to the Task Force on Mental Health of 2020, mental illnesses such as depression and suicide, substance use disorder, bipolar disorder, and schizophrenia and other psychosis account for 13% of the entire disease burden in Kenya.
That's a big number.
That's a big number. So that means that mental health cannot be ignored. And even when the government is looking at covering treatment of various illnesses, mental health coverage should actually account for a big percentage. So it should be covered on your outpatient, it should be covered on your inpatient. If it's private medical insurance, make sure that your insurance covers mental health treatment. If it's the government on this SHA nonsense, they need to ensure.
Is that because you just saw your payslip?
Where? I'm traumatized, guys. I am traumatized. So acha niweke till number. Mtume msaada wase.
I know. We are not doing well.
We're not doing well. Anyway, I know even the rest of you might not also be doing well. So just subscribe to our channel. That will be a big help. Yeah. So even with all that, they need to ensure that the coverage for treatment of mental health is adequate, because if it's accounting for 13% of the entire disease burden, then it means that this is something that cannot be ignored.
But I also like where the regulation is going in, and even before we go to it, it's looking more like the Kenya National Commission of Human Rights is beginning to treat mental health as a human rights issue. They're trying to kind of attach it to the various human rights that are in the constitution, but also trying to create dignity and a sense of belonging to everyone that is that has mental illness or is suffering from a situation that is mental health related. They're trying to create some dignity and cohesiveness and belonging for them.
List for us the different regulations that promote mental health in Kenya.
Okay, so the supreme law of the land, I'd start with the Constitution. So the Constitution actually provides for the highest attainable standards of health for every individual in Kenya. And I think that is the basis of where all health laws come from. It also protects the right to human dignity, which is something that is usually lost a lot when we talk about mental health. Then we trickle it down to the Health Act. So the Health Act, I would say, is the second largest law of the land that deals with health. And it encompasses mental health. And if you look at Section 2 of the Health Act, it defines health to mean complete physical, mental, and social well-being. So there's physical, body, mental, and social well-being. So it encompasses the aspect of mental health.
Yes.
Then now we go to the Mental Health Act, which is basically the primary law that deals with the regulation around mental health in Kenya.
Okay.
After that, there's the Counselors and Psychologists Act, which kind of deals with the issue of licensing and certification of counselors and creation of a board or a body that oversees counselors and psychologists in Kenya. And then there's also the National Mental Health Policy, which is of 2015 to 2030, is it? Yes, 2030, which kind of talks about what the country is doing and what companies are supposed to do to foster mental health in different organizations in Kenya.
Yes. Thank you. I think one of the, have you mentioned the suicide prevention strategy? So that's the other policy document that has been given by the Ministry of Health. There is a policy, suicide prevention strategy for 2021 to 2026 that is aimed at reducing the prevalence of suicide in Kenya.
Okay.
Yeah.
If you look at, maybe we'll go to the Health Act because we're not going to talk about that a lot. But if you read Section 73 of the Health Act, it talks about the establishment of an Act of Parliament that protects the well-being and the property rights and the rights of people with mental illness in Kenya.
Yeah.
And now that is now where the Mental Health Act now emanates.
Yes. Have I ever told you that one of the things that I learned from you when I was new in compliance was whenever you are dealing with any health professional, you need to make sure that they are licensed.
Oh.
Yeah.
Well done, me.
Yes, we were reviewing the Health Act where we were working back then. We were reviewing the Health Act, and one of the things that we were doing is we sent to the HR to make sure that the medical practitioners that were working in the company at the time had valid licenses. Because a lot of times when the medics who are not working in hospitals sometimes don't remember to renew their licenses because they think that, but now
I don't need it.
I don't need it anymore.
Hi, lawyers incorporate.
Yes. So I think that was one of the things that we worked on when I was very new in compliance. Yeah. As Mihala has mentioned, there is a regulation that governs the licensing of counselors and mental health professionals. So when you're going to seek any mental health service, if you're going for counseling, if you're going for therapy, please make sure that the person you're going to is a licensed professional. Or, okay, I see some people going to church. If that works for you, that's also okay. But please remember that you're entrusting this person with your brain. So please make sure that they are a licensed person.
I actually, when we were preparing for this, I listened to a forensic psychologist called, I think, Oscar Gidwa. He used to be a professor at USIU. I'm not sure he still is. But there's something that he mentioned that clicked with me about mental health and the community.
Yes.
So he said a deterioration in the community structure and us going back to the community to tell them our problems has also led to a lot of us being loners and trying to deal with issues by ourselves. And you're saying, and especially in men, wacha tu nijikaze, because I cannot tell anyone else my problems.
Yeah.
And he was giving a beautiful intersection between church and professional counselors.
Yeah.
So he was saying the good thing about how mental health is treated in Kenya today is most people who are aware and in churches will sit with you and listen to you, and some of them will go as far as referring you to proper mental health professionals, which is a good thing. Some churches they'll advise you, they'll tell you what you need to do, but there are some that are working in collaboration with counseling psychologists who are actually licensed and have gone to school for this, and they'll tell you up to this extent, I can pray for you, but the prayers are not 100%. You need to visit a proper counseling psychologist to help you with your situation.
And that's very important. Okay, thank you for that, Mihala. I think now we can start with the Mental Health Act. Maybe you can tell us, give us an overview of what the Mental Health Act covers.
Okay. So the Mental Health Act, fun fact, is almost as old as I am.
Oh,
It was enacted in...
we're going to learn her age
You're gonna
today.
learn my age. It was enacted in 1989, but it came into operation, I think, around 1990, 1991. So this shows that even before we could perceive what mental health as is today, there was thoughts around it. And it was not the only one. Obviously, there was the older Mental Health Act that was brought about by the colonialists. And then the... Okay, so I'm trying to find the best way to explain this.
Yeah.
So first, what the colonizers... What the British did was to lift the Indian Mental Health Act and bring its application in Kenya. And I think this was around the 1940s, if I'm not very wrong. They brought it to Kenya.
Okay.
And it was in operation for a while. And then they lifted a British legislation that was called the Mental Treatment Act. So the thing about the Mental Treatment Act is how Africans were being stigmatized and treated with mental health issues was considered to be very inhumane. So after this, then we had the Mental Health Act of 1989 or 1991, depending on the date of assent and when it came into force. And this kind of helped dignify how mental health patients are treated. But then this legislation is not like in 2024, it's enough. So in around 2019, 2020, Senator Sylvia Mweni Kasanga came up with the Mental Health Amendment Bill.
Okay.
And the Mental Health Amendment Bill added a structure and kind of a right-based approach to mental health in Kenya. So it amended even what you call, it amended even what you call mental health patients. So it moved from persons with mental health disorder to persons suffering from mental illness, just to add some dignity and constitutionalism to whatever the Mental Health Act had. Because when you look at it from the perspective of the 90s, mental health was considered what we used to call, and I'm very sorry to refer it this way, wenda wazimu. Like people who you thought were clinically insane. That is what mental health meant. But when you look at the situation in 2024, there is depression, there's just stress management that leads to mental health issues. There's the whole issue of suicide around not even being able to meet your needs. So there's what I can call softer aspects to mental wellness than just you cannot conceptualize concepts as everyone else does, and you do not fit into society, therefore we have to lock you up in an institution. So I think what the Mental Health Amendment Bill and what the Mental Health Act did is move a step from we need to lock you up to bring us to a place where it's like an all-encompassing legislation that covers not just people with extreme mental health issues, but also what I would term as today's softer mental health issues.
Okay. Yeah, I think that is a very nice and comprehensive overview of the Mental Health Act. Okay, so maybe if you could tell us, what is the role of the Kenya Board of Mental Health?
So the Kenya Board of Mental Health, first of all, I don't even know if it's constituted.
Okay.
I tried to look for information on it online. I couldn't find much of it.
Yeah.
I think around 2022, 2021, there was talks of constituting it, and
it died down.
It looks like it died down. Or maybe it's there, we're the ones that couldn't get that information online easily. But the role of it was to help in the establishment of mental health hospitals or institutions, and kind of regulate and give guidelines and overviews on how mental health is addressed in Kenya. Yeah.
Okay. Now that you've talked about hospitals, maybe you can tell us a little bit about the Mathare National Teaching and Referral Hospital.
Okay. So fun fact, my paternal grandfather used to work at Mathare.
Oh.
Yes.
Was he a psychiatrist or he was just a medic?
God, no. He was a psychiatrist. But this is to tell you that the Mathare Teaching and Referral Hospital is a very old institution.
Yeah.
Because I think it must have been in the 70s and in the 80s. And that is part of where my dad and his brothers were raised. So when they tell us stories, they're like, we would be sent home for school fees and we would have to go all the way to Mathare to look for our mother. And now my grandfather to settle our school fees, and it's a whole thing. It's a whole thing in our family. But it's an old institution. So initially, the way when you go through, I love history. In case you haven't noticed, I absolutely love history. So when you look
explains why you did law.
It explains why I did law. So when you look at the history of Mathare, it initially was meant to, let me use the word quarantine, to quarantine patients with mental illness. And it's because they say even to date there's the civil wing, there's the addiction wing, and then there's the maximum security wing that hosts criminals that are suffering from mental illnesses. So initially, most of how Africans used to be treated was, we are confining you because you have this heavy mental illness and we can't release you to the crowd. And obviously the treatment of Africans by that time was degrading and it was inhumane, and things I think kept on improving over and over the years. So currently, like I said, mostly it's grouped into 3 wings. The first one is the maximum security one that has patients that have allegedly committed crime. And then but are suffering from mental illness. And then there's the addiction wing, or the wing that deals with substance abuse, which again has been a wing that has helped a few members of my family. And then there's the civil wing, which is like general psychiatry. So the misconception around Mathare is, ukienda Mathare, we ni mwenda azimu. And I think it has been like that for a very long time. And it's so crazy, and I see the pun here.
I get
It's so crazy for people to think that, because where Mathare has gotten to now, I'm not saying it's perfect. I'm just saying, like, the people that have gone there, and I know, have been referred to better rehab centers, to therapists, to practitioners that can actually help them. If you are unaware of where to go or how to get help, I think even Mathare Teaching and Referral Hospital being your first point of contact would not be the wrong step. Because like in that place, you'll get the assistance that you need.
Okay. Thanks for that. I think now we know that there are different areas in the hospital that deal with the different mental health issues. Okay. So the other regulation that we talked about is the Kenya Mental Health Policy of 2015 to 2030. Maybe you can tell us a little bit about that.
Okay, so the Kenya Mental Health Policy of 2015 to 2030 is actually a document that was developed around 2014. And one of the things I liked about it, like mark on page 1 of it, it tells us what mental health is. So it says the World Health Organization in its constitution of 1948 defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease and infirmity. Sound familiar? That is the exact same definition of health in our in our health act. In our current health act. Now, the other question that you should be asking yourself is, what are the guiding principles, or what is it that the mental health policy of 2015 to 2030 seeks to achieve? Number one, it seeks to achieve or foster the fact that mental health is an integral part of the health system. So when we were talking about the Shifsha nonsense, like you called it, we saw chronic illness, we saw emergency treatment, we saw inpatient, we saw outpatient. We didn't see a mention of mental health in that whole circuit. And what does that then tell you? Will the funding that the government is giving to SHIF and SHA, will that funding also integrate mental health? That is a question that we should be asking ourselves, because this policy actually seeks to make mental health an integral part of the health system. And what has Kenya done towards trickling this down? I like the fact that Kenya has very beautiful documents and structures in place. When you look at the Mental Health Amendment Act, it kind of tells you what the national government is supposed to do and what the county government is supposed to do. In fact, it clearly states that mental health is a devolved function, just like all the health units. So what is the national government supposed to do? Research. It's supposed to enact legislation regarding mental health. It's supposed to issue funding. Like the main things that the national government does for other health sector, what are they called? Let me call them subsidiaries as well. The county government they're supposed to maintain psychiatrists and medical and mental health professionals. They also deal with the issue of how the hospitals are managed, because according to this policy, there's a community-based approach to mental health. The county government is what is supposed to manage that. That is very clear on paper. Practically, though,
that's another story.
That's another story.
Yes.
So I'll just touch on maybe 5. The policy talks about 10 guiding principles, but I'll only cover 5.
Okay.
So the first one, like I said, is mental health is an integral part of the health system. The second one is mental health is a human right, and we already covered this as well. The Kenya National Human Rights Commission is trying to encompass issues of mental health and kind of directly link them to which constitutional rights are affected if you're in improper mental health, and which statutory violations are a resultant of people not getting the highest standards of, attainable standards of mental health. The third one would be mental health is related to our socio-economic development. If you're not in the right mental health, then you can't go to work, you can't take good care of your family. There's all these issues around mental health that actually affect your general well-being, and it ends up being a ripple effect and affecting even our communities and our economy.
Yes. Actually, before you go to the next point, when you look at whether mental health is considered a disability, there are times when if you have a mental health condition that causes a long-term effect that disables you, for lack of a better word, from doing your day-to-day activities as you used to, then it can be termed as a disability. Yeah.
Okay. That's good to know. And then the next one is the principle of equity in mental health awareness and how we handle mental health issues. So regardless of your race, regardless of your gender, regardless of who you are, the concept of what we are calling now universal health coverage is supposed to ensure that every Kenyan gets the highest attainable standards of mental health.
Okay.
And last but not least, the fifth one that I'll handle is there should be a people-centered approach to mental health issues and intervention. What does this mean? I do not just form a policy because I want to.
Yeah.
We don't go back to the colonizers' way of, now we're bringing you the British Mental Health Act or the Indian Mental Health Act just because we think you need a legislation. Is what are the people's legitimate needs, and how can those legitimate needs be addressed by the policy, the laws, the interventions, the practical aspects that we are introducing into assisting people with mental health issues. There are more guiding principles. There are 10. We'll tag the document in the caption. I'll tag the document in the caption, and then you can be able to read that for yourself. But basically, the goal of this policy is to ensure that all Kenyans, and I'll say this again, attain the highest standard of mental health in Kenya. Again, we already spoke about the roles of the county government and the national government in addressing mental health issues, and this policy puts that into perspective as well. It also talks a little bit about what human resource is supposed to do. From my reading of the policy, it looks like it's the HR of the ministry, but I would guess, it would apply to our normal HR practitioners as well.
Yes.
It also talks very clearly about who are the relevant actors in the mental health space. So there's state actors, and then there's non-state actors, there's private institutions, and kind of like point-wise puts one line, what is your role? What is your role, and what is your role? It also talks a little bit about the monitoring and evaluation situation on mental health issues in Kenya. So it's a very full, encompassing policy. Whether or not it's been implemented, again,
a story for another day. Okay. Thank you for that, Mihala. As we close on the regulations, one of the things that I wanted to ask you is on the treatment of patients. Could you maybe just touch a little bit on what the regulations provide in terms of treatment?
Okay. So when you go back in history, initially you would be committed to a mental health facility, or what they were called mental institution, without your consent.
Yes.
Now there's also the concept of involuntarily being taken into mental hospitals, but the dignity around it has improved. A good example of part of the legislation that deals with this is the fact that the Mental Health Act provides for voluntary admission into mental health institutions. So if you're above the age of 16, it's not even 18, 16 and above, you can take yourself into a mental health institution and say, this is how I'm feeling. The people at the mental health institution have 72 hours to look at you and review you and either refer you to treatment or admit you. If they have not within the 72 hours, you can take yourself out. Again, if you commit yourself into that mental health institution voluntarily and you are of sound mind and you feel like after a few days, I feel like I'm okay, you give them a notice and they have to release you after 72 hours of notification. So in the unlikely event that you voluntarily go to a mental health hospital or a mental institution and you admit yourself, and somewhere along the way things change and you're incapable of expressing yourself, or you're incapable of making your own decisions, the mental health institution is not supposed to keep you for more than 42 days. So on the 42nd or the 43rd day, they're supposed to release you.
Yeah.
What can happen in that sense is probably now your next of kin can kick in and come in and take you out.
Okay.
Why is the concept of voluntary admission into mental health institutions important? Because again, it creates some dignity around it. Remember, we are coming from a colonial period, or from a period of extreme stigma, where we could just they put you in the mental institution and you stay there for I don't know how long without any sort of proper communication. And remember, this is a situation where there's also a lot of stigma around mental health issues. So there's stigma on one hand, and there's you being quote unquote committed to a mental health institution, which did not look good.
Yeah.
There was I'm sure a lot of human rights violations that went on in those periods. But now what the government and the laws are saying is, let's remove some of the stigma. Let's put some dignity into it. If you voluntarily enter yourself into a mental health institution, you should be able to voluntarily check yourself out. And there's a very good hospital. I don't want to mention it because I don't know if we might be sued.
Yeah.
But there's a very good hospital around Riverside that actually looks like a hotel that you can check yourself in.
Yes.
And actually check yourself out when you're going, even just when you're just going through work stress. And these are some of the things that even the private sector is doing to kind of improve mental health in Kenya.
Okay.
Yeah.
That's good to know. Thanks for that. We had also talked about the suicide prevention strategy of 2021 to 2026. So the goal of this strategy is to attain a 10% reduction in suicide mortality by the year 2026. So how they are planning to achieve this is to operationalize suicide prevention programs at national and county levels, which is something that Mihala has mentioned as we're talking about the framework for mental health at national and county levels. Then also to strengthen supportive policy, that's legal and financial environment for effective implementation of suicide prevention program. That's also something you've talked about around the mental health policy, where we are looking at, is there adequate funding for mental health awareness and also for treatment in the country? If we're looking at SHIF and the other funds that have been created under SHA, is there adequate allocation for mental health treatment in the public funding for health? Then the other way in which this strategy aims to reduce suicide prevalence in the country is to improve access to comprehensive, integrated, and quality services for suicide prevention at all levels of care. So that means that at the different levels of hospital, there's supposed to be mental health professionals. Yeah. So in the level 2, 3, 4 hospitals, we should find mental health professionals in those hospitals.
And even before you move on, I think when you listened to, during the COVID period, when you listened to Senator Kasanga talking about why the amendments were being made, is because she was saying, we don't need hospitals. We need professionals in the existing level 2, level 3, and level 4 hospitals to kind of handle mental health issues.
Exactly.
And the reasoning behind that is, for the most part, the mental health issues that the country is dealing with today are actually an outpatient issue. Like you come, talk to someone, and then you go back home. You're monitored from home. Very few cases will actually require you to admit. So the bed capacity that is needed for maybe malaria or the different diseases is actually much less required to compared to what is required for mental health patients.
Yes. Oh, that's very, very nice memory. The other way in which this strategy paper aims to improve or reduce the rate of suicide is to increase awareness on suicide and suicide prevention and address stigma, which is something that we need to also talk about a lot as African societies. Because in our different African societies, the ethnic communities that we come from, there are certain burial rites that may not seem very nice when someone dies from suicide. So those are things that we need to start doing away with, because now families are shying away from saying the cause of the death of their loved one, because they don't want to be stigmatized as a family, to look like, okay, that family has mental health issues, I even hear that back in the day, when someone would be looking for a wife, they would go to check whether that family has a history of mental health illness. And if that family has a history of mental health illness, you're told, don't marry from that family.
See how. But I've heard that as well. I've heard that as well, and I'm part of a community that dying by suicide attracts very wild burial rites in terms of how, the time, and even where you're buried, and how your loved ones' remains are treated just before the burial rites.
Exactly.
So there is actually still that stigma around mental health issues.
Yes. Then lastly, it's to strengthen the systems for surveillance and research on suicide. So which is something that we need, that is actually very important. There's need for a lot more research to be done on how to prevent suicide cases, and also to reduce the prevalence of mental health issues, that especially those ones that are causing long-term disabilities. I think that's something that the government needs to invest in.
I think the other thing that we do not talk about a lot, and you alluded to it, is how many spaces men have to go and talk about those issues.
Yes.
And I see this running joke on social media where men say, don't tell women how you feel, it will be turned against you.
Exactly.
And for the most part, most of those posts are very hilarious. But when you think about it critically, it's basically saying, keep your problems to yourself.
Yes.
So the questions we are asking ourselves is, are there enough spaces where our men can go and speak about issues of mental health, or address mental health without necessarily looking like they are complaining? Because at the end of the day, men do not like to look like they're complaining, or at least that's my analysis of it. They do not want to look like they're complaining. Are there safe spaces for them? There was a period, I don't know if they still do it, there's a period where Man Talk was very vocal about mental health in men. And it was a good space, and you could see like there was a lot of comments and input from different guys, and you could see like the conversations were coming up. But then, I don't know, I don't see them on the upper about it anymore. So the questions we're asking is this something that, even as the government is talking about a community-based approach to mental wellness, can they then create something like this for men? It doesn't have to be, you have to come and sit down. It can be, we can go and play football together, we can go and play golf together, we can go and do all these things that guys do together, but in that space also have a conversation on, where am I mentally?
Yes.
And as I sidebar, when I do my divorce and children's cases, I like to ask guys, how's your mental health?
Yeah.
I ask them, do you have a therapist? And if they don't, I ask them, which is the friend that you talk to this about? Most of the time, they'll tell you, maybe I'm not talking to anyone. Some of them will tell you, I'm talking to this person and this person. There's one that has really impressed me, and both of us know him. And he says, yeah, I'm going to golf with person X to talk to them about it. I have a therapist. And some of these things, they might not look like they're a big deal, but they actually help in protecting the mental health of our men.
Okay. And that's good to know. I think when you've talked about divorce, there's a session in church, one of the Sundays, that they were talking about divorce care. And one of them, was it in church? Yes, I think it was in church. Oh, okay. Then one of the men said that one of the issues that they faced when they went through a divorce, especially if the divorce is about cheating, their friends kind of abandoned him because their wives were like, you're hanging out with that guy who cheated on the wife.
Oh.
Yeah. So you see these guys, so that they can save their marriages and
they're
not
like,
look brother, you're on
utakula
your
nyama
own.
choma yako peke yako.
Yeah.
We are not coming to your hangout.
Exactly.
We're sorry.
Yeah. And you see that, unfortunately, has an impact on that guy because you're going through this very tough time by yourself without any friends or support, because the friends that you have are like shunning you. Yeah. We don't want to hang out with that guy because whatever he's going through, I don't want to look like I'm associated with that.
And I also want my marriage to work. So look here.
So yeah. Wait, sorry for you.
Sorry for you.
Yeah.
Maze pole sa utadu.
But niwe na God sasa.
Yeah.
Yeah, that's an unfortunate bit. Before we close this episode, I think it's also good to talk about private insurance when it comes to mental health. And I've seen a lot of insurance companies have started paying for therapy sessions from your normal outpatient. So they have...
Well done, guys.
Which is very good. So you have your different counselors on their panel or psychiatrists, and you can just walk in, have your session and pay just as you do when you go to any other specialist, which is a very good thing. So if you are covered by an insurance company that's not doing that,
check yourself.
Yeah.
Chief, check your... But I also know of, like, my employer, I really love my job, guys. My employer has a stipend for therapy.
Yeah.
So all you do is you go to a licensed therapist, then you come with the receipt and proof of payment, basically. Like the receipt can be M-Pesa, it can be whatever it is. There are some guidelines that we have anywhere at work that you get reimbursed when you go to therapy.
That's good.
Yeah, and it's actually it's a decent benefit because most of us don't pay anything more than 5,000 for therapy. So the benefit that the organization gives us is actually way above that amount of money. It's not much, but it helps. It really does help, and I feel like that is part of the commitment of HR to helping our mental health at work. They could do more trainings for sure. We could have more trainings on mental health in my workplace. But I feel like the fact that there's the therapy stipend goes a long way. But I also feel like you and I should have an entire full topic with a HR practitioner on what are organizations doing towards fostering mental health in the workplace.
Agreed. So if you have any HR person that you'd like to recommend for us to talk with, please give us their name.
Ingashan. Ingashan,
you already have someone.
I already have someone. Ingashan, nice. We're talking to you.
Very good. Yeah. So thank you guys for listening to us today. I hope you have learned something, and I hope that mental wellness is something that is on your top priority, and also that we will keep fostering awareness among especially the young people, so that we don't have a lot of issues, and even the older generation, because I think one of the most interesting things I remember when I was in high school, there's a time my performance dropped, and the first thing my mom said was, maybe we need to take her to see someone.
Oh.
Yeah, and talk to the person to find out what is the
issue
cause.
is.
Yes, because I think it was their first time seeing a drastic drop in my performance, and because of that, her first instinct was not beat that child.
Wekelea kiboko.
It was maybe she needs to talk to someone. Maybe there's something that has happened or a change that she's not told us about that probably she would feel comfortable talking to someone who is not in our circle, and it would make her improve. And now when I think about it, I'm like,
Miriam, Mrs. Nziyuko.
you are very aware.
Oh,
Yeah, so with that generation, not a lot of them understood the impact of their children talking to people. And even at different stages of life, I think that's one of the things that my mom really encourages, is when you're going through different stages of your life, it's good to talk to someone, because those changes have an impact on your mental health. When you get married, when you get a child, when you get sometimes even when you change jobs, it can have an impact, because maybe you are used to a certain culture. You go to a new workplace.
Did I tell you I had a culture shock when I got to my new job?
No, you didn't tell
Like
me.
100%. I was like, people are treated as humans here.
Wow.
I was like, you can just say you don't know. Like,
Yeah.
but they, as you can literally just tell your boss, I don't know.
I don't know to this. And they will guide
And
you.
they'll just be like, okay, talk to person X.
Nice.
I didn't know.
Yeah.
I was like,
Now you can imagine someone who started their career there, and then they go to a different company where probably saying that you don't know something is not welcome. Talking to someone would really help them cope with a new environment.
I agree. I agree.
So I think talking to people at different stages of your life, you don't have to be having any mental health illness for you to go talk to someone. Yeah. Prevention is better than cure.
Yeah.
Yeah.
And you will be actually, in effect, helping the community
Yes.
to address issues of mental health.
Yes. So thank you. Please remember to subscribe to our channel. Follow us on Spotify and Apple Podcast.
And Instagram as well.
Yes.
Yeah.
Yeah. And also you can follow us on our personal pages. On my personal pages, I'm Danun Yuko.
I am Mihala Barasa.
And thank you. Have a nice week.
And until we see you next time.
Bye.